I'm scanning the room. No notes or books.
Yup. Alright. So the first okay. So the first thing I'm going to do is to walk in, check the doctor's orders or the chart, wash my hands, provide for privacy, and I'm going to introduce myself to the patient, tell them what I'm going to be doing, and then getting to identifiers. So hi, I'm Candace. I'll be your nurse today. How are you?
I'm good. How are you?
That's good. I'm good. I'll be doing your health assessment today. Are you in any pain?
No, I'm not.
Okay. If she was, I'll be using the PQRST. And could you verify your name for me, please?
Tina Patilla.
Okay. And your date of birth?
October 8th, 1967.
Okay. Thank you. And so now we did that. So now I'm going to be assessing her orientation, and before I do that, I'm going to be inspecting. So we're going to be inspecting the she is well groomed. She is alert. She's currently cold right now. And so she is, her body is relaxed and there's no tension. She doesn't seem tensed up. And so now I'm going to ask you a couple questions. Do you know where you are right now?
Yes, I do.
Okay, where are you?
I'm in my doctor's office.
Okay. And do you know what you're, I totally forgot about that, but do you know why you're in here today?
Yes, I'm in here for just a physical.
Okay. And do you know what today's date is?
Yes, November 29th, 2018.
Okay. And do you know who our current president is?
Yes, Donald J. Trump.
Okay. And so her orientation is, she is alert, so like she's alert, and her orientation is times three, so she was able to tell me her name, the time and place, and our president. So she is basically alert times 4. So that means that she so that goes for the Glasgow Coma scale. So her orientation is not, doesn't seem confused or anything, so there's no abnormal findings for that. So now we're going to move on to the head, and we're going to start by inspecting. And for this inspection, we're going to inspect the symmetry and shape, and the shape is normal cephalic, and her head is not enlarged. Have you, before we go any further, have you experienced any headaches or any head trauma?
No, I haven't.
Okay. Any migraines?
No.
Alright. So now we're going to be palpating the head to feel for any lesions or anything. And any pain when I do that?
No.
Okay. And there are any, of course I would have gloves on for this inspection part of it. And so there's no lesions. The hair is evenly distributed for the head and it's very shiny. And yeah, so there's no lesions or any abnormalities that I can find, and there's no ulcers. And now we're going to be moving on to the face. So now we're going to be inspecting the face. And her face is symmetrical. No signs, there's no any scarring or tattoos or anything. She has piercings on her ears, but there's no any abnormalities for that. And we're going to be doing the skin. So I'm going to be using the dorsal part of my hand. And we're going to be, and her skin is dry and warm. And the distribution of the skin is equal for her ethnicity. There's no discoloration or anything. And now we're going to be, so now I'm going to assess for the TMJ. So I'm going to be palpating for that. So can you bite down for me? Move your your cheeks from side to side. Okay. And there's no clicking, no clicks or anything for that one. And now we're going to palpate the two sinuses. So we're going to start for the axillary sinus. Any pain or tenderness when I push down?
No.
Okay. Any pain when I push down?
No.
Okay. So her TN, there was no click, so that means cranial nerve 5 is intact. So now we're going to be moving down to the eyes. Alright, so I'm inspecting the eyes. Eyebrows are evenly distributed for as far as hair. Eyelashes are evenly distributed. There is no excessive hair on the face or eyes. So now before we start the assessment, have you experienced any vision? Any vision loss?
No.
Okay. Have you noticed any blurred vision or anything?
No.
Okay. Have you ever had or have astigmatism or any type of eye disease? Sorry.
I have astigmatism.
Okay. And how long have you had astigmatism?
About 35 years.
Okay. All right. So first we're going to pull down the eyelids, and her sclera is white, and her eyes are. You can stop blinking. All right. Just look up, and her conjunctiva is pink. Oops, sorry about that. Okay, and then so to assess for cranial nerves 3 and 4, we're going to be doing the 6 carnal gazes. So I'm going to have you follow my pen light without moving your head, okay? Okay. So I'm going to be moving it this way, down here. Here. And so 3 and 4, 3 is intact. Thank you. And so now the next test is going to be where I shine a pin light in her eyes, and I did that backwards again. All right. So we're gonna go from here, and we're gonna look and see if they constrict. And her pupils did constrict. Okay. And so her eyes did constrict, so she responded to accommodation light, so Perla, in a sense. And so now we're going to Now we're going to assess the so we're going to assess the nose now. Sorry. So to inspect first, we're going to inspect. Have you ever suffered any acne or anything, or
No.
no? Okay. So her nose is symmetrical and it has no deformities. And so now we're going to be checking the inside of her nose for any ulcers or anything. And to look at her nose, there are some hair but not excessive hair. Oops, sorry. Alright. Her nostrils are nice, being on the inside. They're nice and loose. Okay, and then we're going to so I'm gonna have you cover one of your nostrils. Alright, you're gonna do like this. And breathe. Okay. And same side. Okay. And she was able to do that with no problem. There's no no deviated septum, and so cranial nerve 1 is intact. And to check for cranial nerve 2, I will use the Snellen chart, which I would have the patient, I would have the chart on the wall, and I would have her cover one eye at a time, and she would tell me the letters that's presented on the wall if I had a Snellen chart. And then, so moving down to the, oh, there we go. And moving down to the ears, the mouth, sorry. So I'm gonna have you say ah.
Ah.
Okay. And so I'm going to, her mouth is, we're going to look inside the mouth and have you, and we're going to look for the mucosa on both sides, which is nice, moist, and pink. Alright, and we're going to do, keep your mouth open, and we're going to, sorry. Going to look in this side. There's no ulcers or any lesions or anything. Alright, and so, and we're going to check for the uvula. So I'm going to have you say ah again.
Ah.
I'm just going to keep your mouth open until I'm done. Alright, and her and the soft palate is, there's no lesions or anything on that one, and it is intact. It's midline. The tongue is midline, nice place in pink. The buccal mucosa is nice and pink, and so there's no lesions or anything for that one. I noticed that she has had a filling. Can you lift your tongue? Alright, and her tongue is midline. She's able to move it back and forth. Okay, and she has I see one or two cavities, but other than that, there's no more dental work done. And that's it. Okay, and moving on to the test. So I'm happy to see earlier I said ah, so cranial nerve, she was able to say ah, so cranial nerve 9 is intact. Can you swallow for me? Okay, and so she was able to swallow, so cranial nerve 10 is intact. And can you say light, tight, dynamite?
Light, tight, dynamite.
Okay, right, and she was able to say that with no issues, so cranial nerve 12 is intact. And so now we're going to be moving down to the neck, the ears. We're going to go down to the ears. Please don't do that. Okay, so we'll move this side first. Alright, so now we're going to be inspecting the ear, the right ear, and her ears are symmetrical. There's no lesions, there's no excessive hair on the outside of her skin, and her skin is evenly distributed for her ethnicity again. And so now we're going to be inspecting inside of your ear for like drainage. So I'm going to be pulling your ear back using my pen light. So I'm going to pull your ear back. While I'm doing this, have you experienced any hearing loss or anything?
No.
Okay, so pull up the ear back. I'm gonna have you turn a little bit so I can see better. No, turn your body. All right. So I'm looking inside the ears. No excessive hair or anything. Inside is pearly gray as it should be, and there is no drainage noted. Okay, and we're gonna do the same thing on the other side. And we're gonna, so I'm pushing your hair back. There's no drainage noted. And the inside of her ears are pearly gray. Okay, so now we're gonna be testing her ears for cranial nerve 8. So I'm gonna have you do the whisper test. I'm gonna have you sit over here. And I'm going to be standing behind her and performing the whisper test. So I'm going to have you cover one of your ears. Alright? And I'm going to say 2 words, okay? So,
Okay. Orange apple.
Okay.
Book read.
Okay. And as demonstrated, so cranial nerve 8 is intact. She was able to repeat the words that I said to her. So yeah. So now we're gonna be moving on to the. You can either stand up, sit over there. All right. So now we're going to assess the neck. So now I'm going to be inspecting to see if there's any scars or lesions. And there's no scarring. There's a couple. Have you ever suffered any acne on your neck or anything, or just like pimples or?
Not really, no.
Okay. So let's.
Do you want me to remove my poncho?
Yes, please. All right. So we're going to inspect. There's no excessive hair on the chest, evenly distributed. Her skin throughout was warm, so her skin is warm here. And I also forgot to do this with the other systems, but the skin for the head is warm throughout, warm and dry. And then her ears are also warm and dry for both. And her face is warm and dry. Sorry about the cold hands if they feel cold. And so, and also another thing I forgot is to check for sensations. So I'm going to be touching, so I'm going to have you close your eyes. And then you tell me where you feel my touch. Or you just say you felt it.
I felt it.
Okay.
I felt it.
Okay.
I felt it. I felt it.
Okay. Alright. So now we're going to assess the chest. So back to the inspection part, there's her skin and hair. Skin is warm and dry. The hair is evenly distributed. So now we're going to listen to her the lung sounds, the interior part of the chest, using the I'm going to do that next afterwards.
Oh, okay.
Yeah.
It's nice in here.
Hey.
It's getting to be a little warmer.
Okay. Well, I'm going to hurry up then since. Alright. So now we're going to be listening to the heart sounds first, not the lung sounds. I'm going to do that later. So now we're going to listen to. First, we're going to listen to the aortic valve, which is the right sternum border, and the second intercostal space. Okay. There was no Rakai, crackles, or any other adventitious sounds. And now we're going to be listening to the sorry. We're going to be listening to the pulmonic valve, which is left sternal water, right intercostal, second intercostal space. I'm sorry. And there were no bronchi or crackles or any other abnormal findings, and there was no adventitious sounds or extra sounds that I heard. And now we're going to move down to Earth's Point, which is going to be mid claviculine. Okay. And there were no bronchi, crackles, or adventitious sounds. And then we're going to move down to, which is the third intercostal space for the Earth's Point. And now we're going to move down to the tricuspid valve. So we're gonna have you move up, lift up the shirt a little bit, please. Sorry. And there were no bronchi, crackles, or adventitious sounds noted. And now we're gonna do the mitral valve. Okay. There we go. Alright. Alright, so now we're going to, there were no adventitious sounds or bronchi crackles that were noted that I found. So now we're going to move back up to the neck, which I totally forgot for the first place. So now for the neck, we inspected, and I forgot to palpate for the carotid arteries. Okay. And both sides are +2, so they're equal bilateral. And now we're going to do the same thing, but I'm going to be using the bell side of my stethoscope to listen for any bruits. So starting from here. And there were no boots noted for that side, and we're gonna listen to the other side. Sorry. Okay. Here it's noted. And now we're going to, and then one thing I forgot for the head is to palpate for the temporal artery. So they are +2 for both sides, which they are equal and they are equal bilateral. I'll do it again. So make sure you got that side. Yep. And so they are equal bilateral and they're +2 on both sides. So now we're going to assess the posterior. So I'm gonna have to turn around. We'll be listening to the lung fields with the diaphragm side. Can you take a deep breath for me? Okay. Again. Okay. Again. Again. Okay. Again. Okay. And right here. Okay. Come over here. So breathe in. Okay. And there were no crackles or bronchi noted. And no adventitious sounds, no any abnormal findings, any other abnormal findings. And so we're going to do the same thing for the anterior. So we're going to listen for the lung fields here. Can you breathe in? Okay. Yep. Okay. And there was no adventitious sound noted on both the anterior and the posterior. And now we're going to inspect the china, please. Okay. So while I was doing that, I noticed that there was no any excessive hair for the back side of the posterior of the back. Her skin was warm and dry for both sides, and there was no scarring or anything, no signs of any surgeries. And speaking of surgeries, have you had any back surgeries or any back pain?
Yes, I had a little back pain.
hurting
Okay.
about 2 weeks ago.
Okay. How long has it lasted?
It lasted for 2 days.
Okay. And have you been taking any kind of medication for it?
Not recently because it hasn't been hurting.
Okay. And for the chest, have you been having chest pain?
No.
Okay. So she has, when I did the assessment, there was no signs of any chest pain, and she just stated that she didn't have any chest pain. And so now we're going to be moving down to the upper extremities. Alright? So now we're going to be, before I start, have you had any problems with your joints?
Well, I'm 51, so I have a little arthritis.
Okay.
Yeah, knees and yeah.
Any arthritis in your hands or like your elbows? or
No,
anything?
just the knees and shoulders.
Okay.
Yeah.
Well, since you brought that up, we're going to assess your shoulders. So I'm gonna have you shrug your shoulders. Okay. Any pain when I do that?
No.
You can shrug your shoulders up and down. That's fine. Okay. Any pain or
No.
problems with your range of motion?
No.
Anything? Okay.
No popping. No
okay.
bones.
Okay. And so now I'm going to be assessing your upper extremities. So I'll have you give me both arms. Alright. So the first thing I'm gonna do is I'm gonna have you squeeze my finger so the finger grabs, so you could just squeeze my finger. Okay? Alright. So I'm gonna have you try to push my hands down. Okay, and I'm gonna push up. Alright? And so she was able to do that, no problems with her range of motion. There is no lesions or anything as far as inspecting her skin. The skin on her upper extremities are very warm and dry, and the color is evenly distributed. There's no discoloration. So now I'm going to assess your brachial pulses. And they are +2 on both sides, so they're equal bilateral. Well, quickly, can you show me flexion? So like this, and then extension is like this. All right, and do the same thing on the other. Flexion, extension. All right, and so now I'm going to assess your radial pulse, which is the wrist. So. For both arms. So they are +2 for both arms. Both wrists, sorry. And now I will be assessing, can you rotate like your wrist? Any popping or anything you notice?
Not today,
Not
usually.
Usually? How long does that happen?
It just depends on how much I've used my hand or
Okay.
wrist during the course of the day.
Okay, what type of work do you do?
Right now, I am a receptionist in customer service, so I'm on the computer a lot,
Okay.
on the phone a lot.
Okay.
Yeah.
Alright. Can you show me, can you do your thing on this one? Alright, you can stop now. And, so now we're going to be assessing your abdominal. So I'll have you lay down.
Oh, I just
Oh,
popped
are you
something in my back. That's the bone. That's old age.
Okay. So while she's laying down, I will be checking for the JVD, which is in the neck, which I totally forgot for the neck portion. So I'm have you turn your head. Alright. There's no extension, no extended veins. I'm gonna do the same thing on this side. Alright. No extended veins. Okay, and I'm going to inspect your stomach. Any surgeries involving any surgeries in the past or present for your stomach or?
No.
Okay, I see a little bit of scarring. Where is that from?
Childbirth.
Okay. All right.
Probably from just carrying my child.
Okay. So we're going her contour, her belly is nice and round. Is round and yeah, it's round. There's no lesions, no ulcers or anything. There is no scarring other than the scar from the. Did you have a C-section?
And no, I had natural birth.
Okay, so it's just a scar from childbirth. Alright, so there's just a scar.
You get these when you're expecting. Sometimes you get the line and it doesn't go away after you have the baby.
Okay.
Yeah.
So that's the only scarring, but other than that, there's no other scarring noted. So now we're going to auscultate for the renal, iliac, and the aorta. And as no, I'm having you pull down, not far, but I just need to see your. And the umbilicus is located. It's in it's midline. There's no lesions or anything. There's no excessive hair on the stomach. And then now we're going to auscultate the stomach. Okay. So now we're going to start with the renal, which is above. So I'm going to use the diaphragm side. Okay. So there were no any bruits noted. There were no her bowels are active in the first quadrant, in upper right upper quadrant. Sorry, normal active. I'm sorry. And now we're gonna listen to the left side of that. Okay, we're gonna listen to the iliac, which is on the left side. And the right. Okay. And then, so all four quadrants had no bruits or any abnormal findings. There were her bowel sounds were present in all four quadrants, and they were normal active. And now lastly, we're going to do the aorta, which is above the umbilicus. All right. There are no bruits or any abnormal findings while listening to the bowel sounds. The bowel sound was present, so it was normal active. And now I'm gonna have you sit up again. So first you can take down your shirt, and since I forgot to do this for the chest, I forgot to percuss the chest for any elements, which my bad. Alright, and there were any pain while I did that or any tenderness?
No.
No? Okay. and there were Renaissance sounds throughout. And so now we're going to do the same thing on the back side. Okay, can you turn a little bit from here? If it's uncomfortable, let me know. Are you comfortable?
Yes, I'm fine.
Okay. So now we're going to percuss here. Can you look? Oh, okay. Oh, can you? There we go. Thank you. So we're going to locate that. Sorry. T10. I didn't mean to poke it. Percuss here. Okay, and you can let your hair down now. So there was no abnormal findings. There was no tenderness noted. The sounds were Renaissance as it should be. And so yeah. So now I'm going to do the check for the tactile firmitis. So I'm going to have you say 99 every time I press down, okay?
Okay.
Okay?
99. 99. 99. 99.
Okay. And there was no signs of respiratory distress. So I'm going to have you, I'm going to squeeze and you're going to take a deep breath for me, okay?
Okay.
So take a deep breath. And let it go. There's no signs of respiratory distress on that one. And now, since I totally forgot for the neck, so I'll have you turn around again. Alright, so I'm gonna have for the neck, we're gonna assess the lymph nodes. So we're gonna start with the preocular, the postocular, the tonsillar, submandibular, segmental, occipital, posterior cervical, superficial cervical. So I'll have you turn your head to the cervical chain, not too far. Cervical chain.
You doing a cervical chain on this side?
Yeah, sorry about that. So the cervical chain over here, this side, she was able to turn her head with no problem, which includes that cranial nerve. So the deep cervical chain is over here. And then we're going to do the supraclavicle auricle. Supraclavicle right here. And that's all for the lymph nodes, and they were not, they were soft and they're not movable, as they should be. And so now we're gonna go back to the abdomen. So I'm gonna lay down again, I'm sorry. Alright, so now, we percuss. No. Yep. So we'll percuss on the belly. Any tenderness there?
No.
Okay. Any tenderness here?
Mm-mm.
Here?
No.
Okay. What about over here?
No.
Okay. So we're going to do light palpation, which is 1 centimeter above the aorta. Well, in this case, she has her belly button covered, so I'll have a look down right there. All right. So tell me if there's any pain when I press down.
No pain.
No pain. Okay. Okay. Any
No
pain?
pain.
Okay.
No pain.
Okay.
No.
How's your bowel movements?
They're so-so.
Any changes in your stools, like any blood or anything?
No blood. I'm not frequently going like I need to. I
Okay.
go like every 2 days instead
Okay.
of every day.
How's your diet as far as?
It's lousy.
Okay.
Mhm.
Well, I would say it's important to have fiber and water in your diet. That can also help you make you go.
Okay.
And as far as self care, like how, are you able to get dressed by yourself? You can pull this down now.
Yes, I am.
Okay. Do you have any trouble, brushing your teeth or just doing daily living things?
No.
Okay.
None at all.
Okay. How's your, are you having problems with urination?
No.
Do you have the urgency to go like frequently, like you like every other hour, for
No.
example? Okay.
No.
How is any other changes that you notice in like your stool or your urine? Any
No.
blood in your urine?
No.
Okay. All right. Well, you can sit up now. And now we're going to move down to your lower extremities. Sorry.
Mhm.
So I'm going to have you lift up your like your leg raise. Can you lift up your leg? Okay. Bend your leg. Okay. Any tenderness or pain when I do that? When
No.
you do that? Okay. Have you had any surgery with your legs or any major surgeries
No.
or anything? Any pain in your joints?
Yeah, my knees.
Okay.
Sometimes, not all the time.
How often do you exercise? Or like?
Not very often.
Okay. Well, that's very important to do.
Okay.
Have you been doing using your legs a lot other than like walking, or have you been sitting down lately?
Yeah, I have a job where I sit most of the day.
Okay. Any history of like arthritis in the legs?
Yes.
Okay. How long have you been having arthritis? Have you had arthritis in your leg recently or no?
Well, I think it's in my knees because sometimes when I walk up the stairs, I can hear them popping or they'll get stiff or something like that.
Okay. Okay.
I haven't actually been diagnosed with arthritis, but
Right. Okay. So now we're gonna inspect her skin. Of course, she's wearing pants, so I can't really assess the skin that much on here, but her skin is warm for the most part, unless I can roll up your sleeve. Okay. Her skin is very warm and dry on both ends. Okay. Yeah, warm and dry on both ends. No excessive hair or anything. And I can put this away because I really need this right now. But anything else? Any other changes that you noticed or anything?
no.
No. Okay. So now we're gonna move down to checking her. For the sake of this video, we're not gonna do the femoral pulse. So we're going to go down to the posterior tibial. So I'm going to ask you to, if you can, if it's just tell me if it's painful. If not, if it is, then I can just move the table.
Okay.
Alright, so the posterior tibial is down this way. And it's +2. And so now I'm going to do the same thing on this side. So it's +2. So both are plus. Oh, sorry, I can do it again. +2 for the posterior tibial. And then, so they're equal bilateral because both legs are +2. And so now we're gonna do the popliteal. So I'll have you raise up again. Sorry. So popliteal is +2. It was +2 for this one. And now we're gonna do the. You can let it down now. Okay. Yeah. And now we're going to do the check the dorsalis pedis. +2 for this one. And now I'm going to do the other leg. And it's +2 for this one, so they're both equal bilateral. And while I'm down here, I'm going to check for the capillary refill, even though her toes are painted. But
My fingers too.
yeah, her fingers and toes are painted, but I'm going to be checking both of those. If her toes wasn't painted, there would be her capillary refill should be less than 3 seconds each. Okay. On both feet, if, like I said, if they weren't painted, they would be less than 3 seconds each. And now she mentioned it, now I'm going to do the capillary refill on the fingers, and her fingers are painted, so that's another reason that I'm going to verbalizing about the capillary refill. If it wasn't painted, they should be less than 3 seconds. Okay, and so, like I said, if they were not painted, they would be less than 3 seconds. So now we're going back to the, we're going to be doing, the first thing I'm going to be doing is the gait test. So I'm going to have you stand up. Alright, so we're going to have you walk back and forth. So walk from where you're standing to the stool. Walk back.
Oh, excuse me.
You're good. Okay, so she had no problems walking. I didn't see any, her legs were not dragging or anything, so there's no abnormalities found there. So now I'm going to have her just cross her arms or just whatever's comfortable. Are you comfortable doing that? Okay, so I'll have her close her eyes, and now I'm just going to be watching her see if she's swaying. And so, you can open your eyes now. Alright, you can put your arms down. Alright, and noted there's no, she wasn't swaying, she kept her balance. Her balance is intact. Alright, so now I want you to be able to touch your nose. Like this. Alright, same with the arm. Alright. And now I'm going to have you touch my nose after I just follow, like touch my nose or touch it. Like touch your nose to my nose. There. Alright? Alright. And she was able to do that. And she was able to do that with no problem. And so, sorry. And so now that I'm gonna have you can sit down because this one you're gonna have to sit down too. So for this one, I'm going to have you, can you slide your heel to your shin using your opposite foot? Slide your heel to your shin. I can't do it obviously, but
Here?
yeah, just slide, try to slide it.
Slide it down?
Yeah.
Okay.
Yep, slide your shin. Okay. Alright, and she was able to do that no problem. Now I'm going to have you, since we have to, so for the Babinski test, you're gonna have to have like a sharp optic, but I don't have a sharp optic, so I'm going to be feeling for a response. So, alright. Shoot. I guess I can. No, that's not sanitary. So for the sake of this test, I'll probably just use the pin light. I'm gonna use the Q-tip. I'm sorry, Q-tip, and so I'll have you put your foot like this.
I can feel it.
Okay.
Sorry, my feet aren't. I need a pedi.
It's okay. All right. Feel
I
it?
can feel it.
Okay. And I'm going to do like this. Can you feel that? Is it?
I can feel it. I can feel it.
Okay.
What are you doing?
The Ben. Oh shit. The the Ben Biscuit. I can't say it. Ben.
Bobinsky?
Yes. The Ben. Yeah. Because we have to create. Like, do you have to? So do you feel a response?
Yes.
Okay. Okay. Just doing this. Any tenderness there, or you feel a response?
Not at all.
Okay. Okay. Feeling a response. Alright. And the patient, there's no tenderness noted, and there was a response for that one, but it wasn't a painful response. Was it painful? Like
No, it wasn't painful at all.
Okay. Alright, and so, as far as like joints and stuff, like any pain in your foot, have you experienced
No,
any
no pain in my foot.
Okay, not even when you walk or anything?
No.
Okay. So you did was the rumbar test. I'm sorry. That was the rumbar test that she did. So now, so we're going to. Sorry, I have to get up now. And alright. And so we're I assessed the chest. I'll put this away first. I'm like, alright. So inspect the chest. I already did that. And we already, one more thing I forgot was the thyroid gland. But since it'll create, it'll be kind of painful for a patient because we have to have them swallow. So what I would do to set, is I would palpate the thyroid gland after she would take a drink of water and swallow. But since it'll be painful, I'm not going to do that for the assessment. But before I go, is there anything else I can do for you or any other concerns?
No, not today. Thank
No?
you. You've been very helpful.
All right, thank you. And so after that, then I would chart my findings, make sure the patient has their call light, their slip socks, and of course, make sure they have their call light or make sure they're comfortable, and which she is. And so that's basically it. So thank you for watching.
Okay, you want me to turn it off, or you sure you got everything?
Yeah.
Okay.